we're going live, Commissioner.
Thank you. Like right now, we are?
Right now.
All right. Good morning, everyone. Welcome to the Cook County Public Health and Human Services Board on this Tuesday, August 16th at 8:30 a.m. I'd like to call this meeting to order. And we're unfortunately back into the high risk zone for COVID, so we're wearing masks in the courthouse, and I just ask everyone to speak up a little bit if they can when we do speak, because it can be hard to hear. Microphones help too, so for the public and anyone viewing. First item is the approval of the consent agenda, which includes our meeting agenda and the minutes, financial report, bills, and a couple of HR items as well. Is there anything anyone would like to pull from that consent agenda? Else, I'd entertain a motion to approve the consent agenda.
Mr. Chair, I motion to approve.
Thank you, Commissioner Swalson. There's a motion. Is there support?
Support.
Thank you, Commissioner Storley. Motion and support. Any further discussion? Hearing or seeing none. All in favor?
Aye.
Aye. Opposed? Motion passes unanimously. Thank you. That moves us on down to item number 3, the introduction of new staff. Hand it over to Allison.
Thank you very much, Commissioner Mills. We're excited to welcome Kristina Mattson to the PHHS team. Kristina joined us in July. In July you started, right, Kristina?
Yes.
Yes, so she is our new public health educator, SHIP coordinator, working part-time in support of the SHIP goals and work plan. Kristina brings a great deal of experience in public health. She has a background in nursing, and we're really glad to have her on board. She was at a statewide training for SHIP at our last board meeting, so glad she could join us today. And invite you to say anything else that you'd like, Kristina. We're just glad to have you here.
Thanks for the opportunity to introduce myself here, and looking forward to growing and learning in this position.
Thanks, Kristina.
Thank you, Kristina. Yeah, welcome. It's awesome to have you on the team, and just really excited. I know you're an excellent advocate for a healthy community, and just a really good fit and a need that we have in the organization. So thank you for stepping up, and very excited for what we have in store.
Thank you.
Yeah. Any questions, anyone, for Kristina? Do you have any questions, Kristina? Oh, okay. Well, it's great to meet you, and have a great day.
Yeah, thanks.
Thanks, Kristina.
That moves us on down to item number 4, staff report. And we have our in-home support program coordinator, Savannah Capps, here to give a presentation.
Forget it. Sorry, I thought we were doing that comment.
Oh, I'm sorry.
Thank you. Hi there.
Good morning.
Good morning.
So my name is Savannah Capps. I am the in-home support program coordinator. And I just have a quick presentation for you guys on the in-home support program. So our program mission is supporting the health, safety, and well-being of our community, with our core values being accountability, respect, integrity, honesty, and partnership, with the primary goal to match caring individuals with vulnerable adults in our community, allowing them to maintain their independence. This program is for individuals over the age of 65, regardless of disability, or any adult 18 and over who has a certified disability. The role that I am currently in as a designated coordinator has a lot of different things that I do, but some of the main things that I do is to review the program policies and procedures, ensure that we are maintaining and complying with the 245D statute and all other applicable laws. I train and oversee our service providers. I initiate and match service recipients with their providers. perform regular service reviews with our service recipients, act as an information liaison for any questions and concerns, whether that's from our providers, recipients, or the general community. I do billing review and troubleshooting for billing, and then lots and lots of paperwork that goes along with that. Some of the essential services that we provide are cleaning and organization, meal preparation, transportation for errands or medical rides, respite care, companionship, and personal support. So this is basically the non-medical side of helping people stay in their homes. And why these services are so essential is that many of the people that we serve are the most vulnerable within this community, and we help them to ensure that their needs are being met. It gives companionship to some people who are extremely isolated and lonely. Many of these people have no way of getting out of their houses without help. And it enables elders and disabled adults to maintain their independence and personal dignity for longer. Currently, we have 15 providers, 1 in the West End, 12 in Grand Marais, and 2 in the East End. And we're currently serving about 40 recipients at this time, with 2 being in the West End, 5 in the East, and 33 of that being right here in the Grand Marais area. Our services can be funded in a variety of ways. Some of that is through state-funded waivers. That would be the AC waiver, elderly waiver, CADI, developmental disability, brain injury waivers. And these reimbursements to our providers who perform the services are about $18.44 to $20.16 per hour, depending on the waiver. And these are for clients who qualify for the waivers and would include case management through the county as well. We also have the sliding fee scale. This is for individuals qualifying by income who are 65 and older. We have adult mental health money, which is about $18.44 per hour for most services, and that must be pre-approved by their adult mental health case manager. And then anybody in the program has the option to pay privately. Our current private pay rates are negotiable between clients and their service provider, and the rate is about $20 to $30 an hour, depending on provider and depending on the services that they're being asked to provide. We have 9 clients currently on waivers, 18 with a sliding fee scale, so about half of the program is on our sliding fee scale. 10 are private pay, and then we have 3 adult mental health case management clients who are receiving funding via that method. Some testimonials from this program that I would like to just highlight, because this program is not only valuable to our service recipients, but also it's a lot of intrinsic value to the providers. Some of our service providers, one of them has said, "I like him a lot. He's been taking me out, and it's the first time that I have left my house in 2 years. We get along really well, and I'm glad I have him." Another service recipient, when asked about her provider, said she does so much for me and never complains. "Sometimes I just need to talk about my problems while she's here, and she's always takes the time to listen to me, and every time she leaves, me feeling 100% better." 2 testimonials I would like to share from our providers is, "It has reinforced the value that I have placed on the elderly and multi-generational relationships, and motivated me to see what else I can do to improve and facilitate more support." Another service provider said, "It is a very enjoyable thing that we are doing because you feel like you are helping people. You become friends and sometimes even like family to your clients who are so often lonely. It is endearing and eye-opening to see what others go through." So as wonderful as it is, and as much as our providers love doing their work, one of our biggest challenges, as is with many organizations and jobs within this county, is continuing to find enough providers to meet services. And our waiting list does continue to grow at a faster rate than our availability to provide services. And seasonal availability is another thing that really affects our services. Summer is really busy for a lot of our providers, and it is a challenge in maintaining consistent care at this time. Cost of gas has had a negative impact on driver willingness, especially for those longer trips, as well as their availability. And then COVID-19, as with everywhere else, continues to prove challenging at times. But we do have many victories that we like to celebrate within this program. We have been able to contract 3 new providers this year. Our providers have filled in service gaps with our current clients, and we're hoping soon to be able to get through some more of that waiting list. Service recipients have been able to meet long-standing goals with our new providers, such as being able to get out of their house. And the start of the school year should open up some provider availability, allowing us to hopefully get through at least a little bit more of our waiting list and provide more services. In order to retain our current service providers, we are extending the provider stipend of 50 cents per unit through 2023. This is to account for increased inflation and rising costs. And this is included in our 2023 budget proposal. We are now, or have been, continuing to train and offer training electronically for our annual trainings for providers. This allows them to complete it on their own time and work within their schedules. And continued flexibility in how we provide our services is going to continue to be a major effort and stronghold that we are focusing on. Service providers can take on as little or as many clients as they want, as can reasonably fit within their schedules. And that can be provided at days and times that work within their schedules. So it's very negotiable. We try not only to, when we're matching service recipients with providers, to match what our service recipients need, but also to match what our providers are looking for as well. Heidi, thank you very much. Does anybody have any questions?
Thank you, Savannah. Any questions from the board? Commissioner Storley, please.
Yes, thank you. Thanks for the report. This is great. A better understanding of the services on both directions, the comments from the clients and from the staff. I do have a couple questions. One, what does it mean when you said the stipend of 50 cents per unit? What does that mean?
Per unit of pay. So our units are in 15-minute increments. And so it's about 50 cents would be per that 15 minutes worked. And that can be very varied among providers how much they're getting because of that. Some service recipients, they only, especially on the sliding fee scale, they only get up to 20 units, so that's just about $10 per month per sliding fee scale recipient. If it's somebody who's getting more or less than that, depending on if they're on a waiver or adult mental health funds, it would be different. That does not include private pay clients. So this 50 cents per unit would be for people who are on the waiver, the sliding fee scale, or adult mental health.
Okay. And then in the community, Care Partners also has folks who go out. How do you, are you totally different than Care Partners, or do you kind
That's
of
a great
blend in
question.
your services?
We do work closely with Care Partners.
Okay.
They do provide very similar services. The difference between Care Partners, and one reason we definitely work a lot with them, is Care Partners tries to, at least for the most part, provide services on an as-need basis. So people who don't frequently need the same service, whereas our clients are put with the same provider and getting services on a consistent basis. So it just depends on what the client is regularly needing, how much they're regularly needing, whether or not they'd be a better fit for us or for Care Partners. Because we are giving consistent services, it allows us to have these providers and have care plans that can be more or less met on a structured basis, whereas Care Partners is just for the most part, designed to be an every now and then service for an individual as they need it.
Okay, very good. Thank you.
Thank you, Savannah. Martina, did you want to add to the 50 cents per unit?
Yeah, I just wanted to say that is currently in effect, that 50 cents per unit stipend. Anita Josiah, when she was the coordinator and came and presented to the board, she talked about that. We put that into effect because the wages or the rates for reimbursement from the state have stayed really stagnant for a decade. And so we really wanted to try to incentivize people to do this work. And so that has been in place, and we are continuing that into the 2023 budget.
Thank you, and thank you for clarifying the 50 cents per unit. I remember our $2 an hour vote,
Okay.
and I didn't remember the 50 cents per unit vote, so that helps. That's the same thing. Thank you. Any other questions for Savannah? All right. Well, thank you very much. Very good presentation. I mean, this service is clearly so important for building community and supporting community. I know at least one provider, and he loves it. I've known one provider in the past who has also got a lot out of it, just as far as the personal aspect of it and developing relationships, and clearly with those anecdotes, I mean, we know the challenges that our seniors and also most vulnerable have. So I really appreciate your work towards supporting them.
Thank you.
Yeah. Have a great day.
You too.
And I should note I'm a little slow in general on things, but I'm reading the room a little bit and based also on Administrator Yorkie's assumption that there would be a okay. I'm still slow.
Need to vote on that?
Yeah. Is there a motion to recognize me? That moves us down to item number 5, our COVID-19 situation with Grace Grenager. Good morning, Grace.
Good morning. Can you all hear me well?
Yes.
All right. Well, I'm going to keep it brief today. We do have some updates to share, but we are kind of moving into more maintenance mode with regards to COVID-19. However, we are seeing an uptick. We are in high transmission at this point following the CDC's levels. Again, we check every week what the CDC's update is, and we manually add in the over-the-counter tests that have been reported to us. That's why weeks such as this week, CDC shows us that medium, but when we plug those over-the-counter positives in, it brings us to high. So that is that discrepancy. And when we have high transmission, the CDC recommendation continues to be mask use in indoor public spaces. Our case count is at 1,267. We've had 128 cases since our July PHHS board meeting. In terms of activities with regards to vaccination, we are working very closely with the clinic at this point. So we're planning to be at the ISD 166 open house on August 31st with Sawtooth staff to be able to check as families are coming in if they opt into this, whether their child is up to date with routine vaccinations, that would include COVID vaccinations, and if they want help scheduling to go in for an appointment to catch up with routine vaccinations, including COVID vaccinations, they're able to schedule that on site. So that's a collaboration we're working on. It's part of both the effort to increase our vaccination rate for COVID, but also to really catch kids back up as we've seen kind of decreases in rates of vaccination coverage for other childhood vaccines during the pandemic. We had 2 successful 6-month to 5-year-old vaccination events with the clinic at the community center in July and early August. At this point, after those events, vaccination overall has moved in-house at Sawtooth Mountain Clinic, which is exciting. We are anticipating that in the late fall, early winter, we are going to need to do boosters. Again, we don't have any dates. It's all dependent on the CDC, FDA review process, but there's a very strong possibility we're going to have to do a general booster push, possibly with a updated vaccine formulation at that point. So what we're doing now is pre-planning, essentially. We're going to need to look for alternate sites to do mass vaccination. I'm glad the Curliers are going to be able to use the community center space. They've been very patient and gracious with us to let us use that space, but we are going to need to look for an alternate site or sites, depending on what that booster campaign looks like in the late fall. We're also working with the clinic to do a postcard mailing. I mentioned we're trying to boost the rate of people who are up to date on COVID vaccinations. It's really rather low. Because of the updated recommendations for boosters, our up-to-date rate in the county is at 46.2% right now, so we have some work to do. We're working with the clinic to send out a mailing just, asking people, are you up to date? Here's how you can check. Here's how you can schedule, just to let people know we do still have vaccinations available, and this is how you access them at this point in time. It's really by calling the clinic and connecting with them for care. And also, if you have questions, talking to a medical provider at the clinic. We're always happy to answer questions at Public Health as well, but I know for many people that reassurance of talking with a medical provider really makes a difference, so we want to encourage that as well. We are putting out a media release today. Late last week, the CDC updated some of its COVID guidance. So the media release will really reiterate what those changes are. The big one is that they're no longer recommending quarantine for people who are exposed to COVID but not up to date on vaccines. Everything else is essentially the same. So at this point, if you're exposed to COVID, regardless of your vaccination status, the recommendation is to wear a mask for the following 10 days after your exposure, monitor for symptoms, and at day 5 or earlier, if you show symptoms earlier, test with either an over-the-counter test or through the clinic lab system. So we want to make sure that people understand what that new guidance looks like as it kind of came out on a national level, and we want to make sure people know, this is what it means, and then also to let people know how, again, they can access tests and masks in our community, both through the clinic hospital system and through our system of kind of drop sites throughout the community where people can pick up masks and over-the-counter tests. So we have information about that in the media release. We will be reconvening with our school partners in late August just to go over updates to guidance for schools. And finally, the North Shore Healthcare Foundation facilitated a donation drive for the COVID-19 response, and we have a small amount of funds remaining in that. So we are partnering with the North Shore Healthcare Foundation to do a volunteer appreciation event in mid-September for our Minnesota Response volunteers using the donated funds that the foundation has collected. So we're going to be sending out a save the date at some point very soon, and then mid-September we're going to be hosting a thank you event for our volunteers. And those are all my updates. Happy to take questions from the board, and as always, thank you for continuing to invite me to your meetings to provide updates.
Thank you, Grace. Any questions for Grace this morning? Commissioner Storley?
As always, Grace, thank you. I'm just trying to figure out when the CDC explains what's going on in each area, how do you know here in the county, are people calling in? So how do we know that last week we had an influx and now we're at high? How do you know that locally?
So we, the reports of cases that go to the CDC funnel through the lab system. And what we've seen is that's about, I mean, it's varied over the course of the pandemic, but roughly a quarter of the tests are actually going through the lab system and reported out to the CDC. Probably 3/4 of the positive tests we have are self-reported through people calling public health or calling the clinic and, you know, then being directed to us and asking for information about how long to stay home. So we still are happy to take those calls if people test positive with an over-the-counter test. One of the big things, aside from just getting a better read on how many cases we have, that I think is really valuable about that is if someone takes an over-the-counter test, they might not know that they could qualify for some of the treatments out there. And we really want to make sure people are connecting to a medical provider if they might be a good candidate for an antiviral or monoclonal antibody treatment. And that's, I think, a gap overall in the public health system that we've been able to mitigate somewhat locally by just taking those over-the-counter tests. So when we add in, we have a tracking sheet of the over-the-counter positives, and then we plug the number of overall tests into the CDC's formula to determine community levels.
So we wait now for this Thursday to see what happens.
Yep, it's Thursday night, so we wind up calculating it Friday just because it's after work hours that the CDC updates their numbers. So Friday morning, we always update our local numbers, and then we put it out on social media, usually around midday on Fridays.
Do you think that we are facing a little bit higher because of visitors?
You know, it's hard to say. I think over time, I think the trend has been really social gatherings. So it can be within, a workplace where there's lots of people who are in close proximity on an ongoing basis. It can also be things like family reunions or family vacations. It's really that kind of sustained close contact in indoor spaces. So to the extent that you have visitors from out of town spending lots of time with you, I think that's probably more probable than, say, a tourist checking in at a hotel and then passing COVID to someone working behind the desk, for example. So I think places like, restaurants where you're indoors for a long period of time and everyone's unmasked are a little bit higher risk than maybe a retail space, for example, but it's kind of hard to say where exactly all the COVID is coming from. It's just the new variants are very contagious, essentially. So whenever there's people together indoors for a prolonged period of time, there's a higher chance of transmission.
Thank you.
Thank you, Commissioner Storley. Thank you, Grace. Any other questions? Mr. Yorkie?
Yeah, so I was surprised to hear, Grace, that the percentage of folks who are reporting versus getting actual tests at the clinic is so high. You said about 3/4 of all positives. And that makes me, first of all, I think it's great that people are reporting to that extent. That's really good. But it makes me wonder, is there an adequate supply of at-home test kits?
I think there are.
Okay.
We have sites throughout the county, and what we do is we put a little sticker on them that says if you test positive, call public health, and then we'll we're happy to talk people through things. And, they're not required to do that, but if people opt in, we're happy to give people information on how long to stay home and how to connect with treatments. And the clinic has been able to order at no cost tests through HRSA. And so then we've kind of distributed them throughout the community, and we check back in with the distribution sites to make sure they're stocked. So
It's really heartening to see that people are so willing to report that information. That's helpful.
yeah, absolutely. Absolutely.
Any other questions for Grace? I have one just about our up-to-date percentage. I'm assuming that's only for eligible population, or is that for
That,
the
at this
total?
point, that is anyone over the age of 6 months. So,
Oh.
because the 6-month to 5-year group was recently authorized to be eligible for vaccination, and that's part of why our number dropped, is
Sure.
because there are people who are now up to date, but that group is probably just now coming into up to date if their parents brought them in right away. So it's a relatively small group in our county, but if you look at the number who've gotten at least one vaccine dose, it's 87.7%. So there are a number of people who've been at least partially vaccinated. And I think part of it is just that education, like, yes, this is available, this is what's recommended for you, this is how you can sign yourself up for an appointment. So there's a pretty big gap between up to date and having at least one dose.
Thank you. All right. Well, thank you for your time this morning. Thank you for all your work. Yeah, I know, at least in my circles, a number of them, COVID is hitting really hard, both just how it's spreading and also some side effects or just some symptoms are pretty hard hitting now too. So it's everywhere, right? Everyone be careful and be safe, but thank you, Grace.
Absolutely.
Well, that moves us on to our next item 6, the director's report. We'll start with staff updates. Good morning, Allison.
Good morning. I just want to share some feedback quick from one of my colleagues who's tuning into the live stream, that it's really challenging to hear with the mask. So just want to encourage everyone to get close to their mic and really project when speaking. Also want to propose...
Allison, I'm sorry, is it possible, is that fan at the lowest setting, or?
It is.
It is,
yeah.
okay.
I'll turn it off for now, if that's all right.
But that helps us talk louder, right?
What I'd also like to propose for my report is to briefly give a staffing update and then focus on some of the department updates that are a precursor to our items for board action. We have some guests with us this morning who are involved in the Rural Childhood Innovation Program, who are here to be able to offer perspective and input as it relates to that request. So what I'd like to do, if it pleases the board, is to do my staff update, talk about the Public Health Fund recommendation as well as the Child Care Program recommendation, and then defer the discussion of the Behavioral Health Supervisor until later in the report, just to honor the time of the folks who are with us this morning.
Sure, that sounds great. Thank you.
Okay. So to start with a staffing update, I am very happy to share for the first time in many months, we don't have any open positions for recruitment. We do have a number of positions in various stages of recruitment, but no open active applicants at this
Wow.
point. So at your last regular board meeting, or it was 2 meetings ago at this point, I believe Andrea Cuthbert was hired as our new eligibility specialist. Andrea is starting September 6th. She comes with a great deal of experience in a hospital setting, assisting people in enrolling in medical assistance. So we're really glad to have her on board and the experience that she'll bring to that role. Adam Maxwell was on the consent agenda this morning. Adam is starting September 19th as our children's mental health case manager. Adam has experience in a variety of youth serving settings, including special ed, environmental education, and in youth residential treatment settings. So really excited to be welcoming both Adam and Andrea to PHHS next month. We do have an offer extended for 2 other vacant positions within the department, one being the Family Services Case Manager, backfilling the vacancy created by Reed's recent resignation. And we also have an offer pending for the new Coordinated Response Mental Health Crisis Worker as well. So really anxious and anticipating those positions being filled very soon. We are also determining how to fill the vacancy created by Heidi's resignation. Heidi, as you likely know, is our licensor for the department, so we're looking at opportunities to reconfigure that position in light of what appears to be broad support for a child care coordinator position. Can we incorporate some of those administrative functions within Heidi, or within that licensing position, to provide more administrative support to our child care providers throughout the county? So more to come on that. That would certainly necessitate a job description review, personnel, job evaluation, and many other steps in order to reconfigure that position. But just want to let you know where we're headed with that and exploring that position. Also in the works is we're developing a temporary staffing training contract with Sarah Hadley, our former executive administrative assistant, hoping to bring her back on board to provide some support to staff in training on the substance use disorder financial eligibility determinations. That was something that we didn't have sufficient time with Sarah's departure to cross-train staff on that program. We're hoping to have Sarah come back on board for a very short term, very limited hours, up to 5 hours per week, to help us get caught up on some of that data entry and then provide training to staff, to a group of staff, to ensure we're sufficiently cross-trained. And we do anticipate having an agreement for approval at next week's regular board meeting. Just didn't have things finalized in terms of the terms of the contract for this week. Any questions on staffing updates before I move on? Okay. I'm going to defer some of my other department updates for later in our discussion, but want to just draw your attention to the budget update that was included in the agenda materials. In the area of economic assistance, we removed healthcare access expense and revenue and added a projected contracted cost for MTM, which I will say a bit about more later. That's a transportation management provider that we're exploring contracting with beginning in 2023. In the area of social services, we updated payroll estimates based on recent personnel changes and further reduced our levy request by updating that planned use of fund balance from $100,000 to $200,000. In public health, we have increased the public health grant funds based on committee recommendations. You might remember last month I shared that tentative recommendations were developed. The committee wanted to ask additional questions of some of our applicants, and following that, did provide an updated recommendation, which is included under items for board action and in the updated budget. And we've also added the child care grants, which would be a planned use of fund balance up to $360,000, and we'll have more discussion about that shortly. Our new levy request for 2023 is a 0.39% decrease over last year and is essentially the same levy request as 2018, which I thought was pretty surprising. Page 88 illustrates the impact on the PHHS fund balance, assuming that maximum use of reserves in 2023. The fund balance compared to our 2023 budget after that maximum planned use would still be at 69%, which is still well over the recommended 40% per our county fiscal and fund balance policy and recommendations by the Office of State Auditor. I have Lori Erickson here to address any questions that you might have about the budget update at this time.
Thank you, Allison. Any questions from the board for Allison or Lori? Not yet.
All right, so I'll move us into the discussion of the public health grant funding recommendations. for 2023. So again, members of our Public Health and Human Services Advisory Council reviewed grant requests for 2023 funding from 8 local nonprofits that serve a public health purpose in the community. The summary of historical funding and the 2023 budget year requests and recommendations were included in your board materials. The total requests this year was $242,436. And the recommended amount to grant out across all of those 8 organizations is $191,000. I do have a summary of each applicant and the requested funding, what programming, staff, or other expenses that will support, and I'm happy to run through that now.
Yes, I do have a question though that came up in my, going
Absolutely.
backwards a little bit, sorry. That increase for, the increase for the planned use of fund balance from 100,000 to 200,000, that, and maybe I just missed this, that 200,000, that additional 100,000 is still if needed for out-of-home placement, right? Okay.
Yeah.
Thank you.
For general social services
Okay, yep.
expenses if needed, yes.
Thank you.
Absolutely.
Okay, please continue.
Brief summary of our public health fund applicants and recommendations. Birch Grove Community School applied again this year, requesting funding to support school year and summertime preschool programming at Saplings, summertime school-aged care at Campsite Kids, and school-aged before and after school care during the school year. Care Partners applied for funding to support volunteer coordination, chore services for elders, the Aging Well resource website, mileage reimbursement for volunteer drivers, and program outreach. Cook County Community Ed is applying for funding to support staffing, supplies, and scholarships for youth sports, as well as school-age childcare during summertime via the YMCA Summer Camp Program. Cook County Higher Ed applied for funding to provide sliding scale scholarships for Cook County Higher Ed programs that are aligned with the community health assessment priority areas. Cooperation Station Child Care applied for funding to support staff salaries, a self-care fund for staff, and training costs to provide child care, including after-school care during the school year. Great Lunch Program was our new applicant this year. They applied for funding to subsidize breakfast, snack, and lunch programming at GES, as well as the free and reduced lunch program at GES. The Hub applied for funding to support their food program, supplies, and staff costs associated with the Hub's food programs. And finally, Violence Prevention Center applied for funding to support their 24/7 support line for people subjected to or affected by domestic violence, sexual assault, or human trafficking. And the funding is specifically directed towards staff time, training, and outreach for volunteers and stipends for volunteers that staff that line.
Thank you.
So in the packet, you can see again the historical funding amounts beginning in 2019. Which was the first year that the Board of Commissioners delegated authority to the PHHS Advisory Council to review and make funding recommendations. The 2023 request and recommendation, and the summary of the total amount granted over that time period. Any questions on the Public Health Fund grant recommendations? I will just say quickly that I can offer some options for consideration in terms of how these funding recommendations might interact with any additional child care subsidies as we presented last week. So options might be that any recipients of the Public Health Fund would not be eligible to apply for subsidies in 2023. That would probably be the most straightforward path. Another option that the board might consider is to ask the review subcommittee to reconsider any grant recommendations for child care providers and reduce the grant for any direct provider subsidies. And that would be contingent on the development and approval of any child care subsidy program in 2023. There may be other options. Those were just two potential to consider in terms of how the public health fund recommendations before you today might interact with the subsidy program.
Right. Yeah, that gets a little tricky, huh? How many providers are at Cooperation Station?
I believe it's 4 total providers with 3 FTE.
Okay. And then the community ed, could you say that one again, please?
Yeah, so Cook County Community Ed, this is ISD 166, applying for funding to support staffing, supplies, and scholarships for youth sports, as well as school-aged childcare during the summer via the YMCA Summer Camp Program. So again, that funding amount is supporting both supplies, scholarships, as well as staff salaries. So we would want, you might ask the review committee to reconsider that recommendation if we are to move forward with any direct childcare subsidies.
Yeah. And kind of break that out a little bit and get into the nitty-gritty potentially. Okay. Any questions? Oh, yes, please, Rana.
Well, if we did that, then would there be money available back in that fund for other things this year, or would it just sit there for another year until applications were due?
The public health grant fund,
Yeah.
those are levy dollars. So that is, those funding recommendations are included in our budget, and that's a levy amount. So we just would reduce the levy request
Okay,
if those funding recommendations were reconsidered.
okay.
And Rana, I'm sorry, could you bring your microphone down to you as
sorry.
well?
Okay.
Yeah,
all right.
thank you. And just to also point out that the total grants requested is 242,000. The recommendation is 191,000. So if we do kind of, if we ask the subcommittee to review this, that could bring both the requested amount as better in line with what's recommended, and not have to push that over what we had budgeted for. So there's, I don't know, in my mind, that makes things a little smoother, for as messy as it can get, so. Any other questions?
No, I support, as you say, if we take further action, then we need to do those further reviews to make sure that we're offsetting that. And we want to be fair to folks, but we want to make sure that we're not over fair, so to speak.
Over fair, I like that.
Yeah,
Yep,
it's a new term for you.
it's a goodie, it's a goodie.
I try to help out.
All right. Well, I guess that probably brings us down to the board actions. And in our agenda, we have the public health grant funding requests first, and then also the next one is the RCCIP SMART goals. And we just kind of talked about how those may or may not interact. I guess I'd like to ask the board if they have thoughts on the advisory or the grant subcommittee recommendations. If there's anything that stands out. I saw you move.
Yes, I moved, yes.
But that means you have some,
I do.
yeah.
I do
okay,
have
please.
something to say, because
Please.
I do have to say, I am also on the Budget Advisory Committee. This process was talked about last month's meeting. Like the fact that there was a subcommittee group discussing and evaluating, making recommendations. There was concern expressed about the percentage of increase on levy dollars, and wondering who determines because we are a budget advisory committee, and it's, kind of seems to me this process is not fair. Other places, other departments make requests. It's brought to the budget advisory committee to give our input. We did not know what to do with this one. And I just guess I have a problem with this process, and
Commissioner, could you say a little more about that?
well, yes, about
May
that.
I interpret?
Well, I will say it one more time. The percentage increase has been more consistent over the last, 4 years here? And now we jumped. And what is the percentage increase for 2022 to 2023 increase in these requests?
It is an increase of $53,300 over what was awarded last year in grants. So this represents a 39% increase. So you're absolutely right, Commissioner Hawkins. This is the most significant increase. And I can speak to the rationale behind that this was a recommendation of our Public Health Fund Review Subcommittee, and based on feedback from this board around the time that the grants were approved last year, to move that timeline up earlier in the year so that we can make a more informed budget request earlier on in the budgeting process, so as not to be hampered by the original amount that we requested in terms of meeting local needs from our
And I
nonprofit
supported that. I
entities.
thought that was a good idea. I appreciated the time it took for that committee to do that, make their recommendation. But as I said, I'm on the Budget Advisory Committee, and it seems like we are tying their hands as to input on advising us on an overall budget, when we might be taking a vote here to say we overrule whatever recommendations or thoughts you had, and I just need to express concern in that advisory committee about the percentage increase and feeling maybe that was not totally appropriate. There.
And if I may, Commissioner Hawkins, I'd be more than happy to bring this information before the Budget Advisory Committee to give a presentation on the history of the Public Health Grant Fund and be responsive to any questions that the committee members might have.
That sounds like what the Budget Advisory Committee is asking for, more or less, right? Is to be involved in this process as we
Well, and I
set the
guess
budget?
The reason I was asking for clarification is I just wondered if I missed a step. And if I did, then I apologize for that. But I understood that because, I mean, the board makes the final decision on the budget, but the Board of Public Health and Human Services oversees the development of the PHHS budget. And so I guess I'm a little unclear about how those two processes fit together. And if the Budget Advisory Committee wants to have a presentation from PHHS about these grants or anything else, we can certainly enable that, but it wasn't really on my radar, so.
Then, yeah, so what I'm hearing or understanding is that there's concern on the Budget Committee because of the amount of increase. Is that right? Was it also the process of not being in that loop, or just
No.
the sheer percentage increase?
That was a concern raised, and we didn't have a decision at that meeting of should we come back and recommend. I guess the process is not clear because they felt like, well, wait a minute, how does this group get to decide when our job over here is to advise? Are we just a rubber stamp then for whatever is put before us?
Okay, so the concern is both the sheer percentage increase as well as potentially where the Public Health Grant Subcommittee integrates with the Budget Committee. Those are the two concerns that I'm hearing. Right, okay.
So in the past, has the Budget Advisory Committee reviewed the grant recommendations specifically?
Well, and I guess that's where I was, so that's why I was like, yes, it sounds like that's what the budget committee is asking for, and I really appreciate your willingness there. My concern would be, basically the Public Health and Human Services Board is setting the budget for the department. That includes the public health grants. That then goes to the Board of Commissioners, but does the department budget go to the Budget Advisory?
We included that information
Yeah.
in what the budget
Yeah.
committee reviewed, the Budget Advisory Committee, yes.
Yep. And so, it sounds to me, based on the Budget Committee's concerns, that they would like to talk more about this increase, and then that would alleviate also the process concerns by being involved in that conversation. I don't know if
guess I
that's...
didn't get that signal as clearly as Commissioner Hawkins
Okay.
may have gotten it, so.
Okay. And for my part, just the sheer percentage increase may or may not be affected by further board action items that are coming up. So it's a bit of a moving target in my mind. But I think those concerns are worth talking about and getting everyone on a similar page. Is there, as far as timing wise, how might this work out logistically?
Hang on a moment.
I can just speak to our budgeting process, and that our primary deadline is the overall county levy being set in September, and we certainly could reduce that amount based on any development of a child care subsidy program. I would be reluctant to say that the Budget Advisory Committee could override any recommendations made by our PHHS Advisory Councils. I feel like that really defeats the purpose of having a group of citizens, community members, volunteers go through the process of reviewing and making recommendations if they're then going to be...
Yeah, and I understand that concern. I don't think that's the intention here. I think the intention, my interpretation is the intention is, once this board approves or disapproves whatever grant requests, then the whole budget would go to the Budget Advisory Council, and they can talk about that. And then they can also make recommendations to the county board. So it just sounds like a little bit of redundancy, but I think it's important to have everyone in the loop there and part of the conversation. I think that's really helpful. As far as an override is concerned, that's going to happen at the regular Board of Commissioners, if at all. I guess your concern is if there's two conflicting recommendations, is that?
I would just want to be clear with what the role of the Budget Advisory Committee is in this process. If it's to provide information, answer questions, certainly we're happy to do that as it relates to these grants or the PHHS department budget as a whole. Lori and I have attended Budget Advisory Committee meetings in the past and are happy to do that again.
Yeah.
I think there's also a question of the granularity of data that the Budget Advisory Committee expects, because
Sure.
We have provided all three, the general fund, PHHS, and highway budgets. So they've got the big picture, and they've also got the budget detail. So I agree. I just want to make sure that our mutual expectations are clear, and that we're providing adequate level of detail without, again, stepping on the toes of committees that have been formed specifically to, in this case, make a recommendation about these grant funds.
Yeah, I think I would have preferred to have the Budget Committee's concerns and about the dollar amount for the public health grants coming before us before the recommendations of the committee were brought before us. So that makes it tricky in my mind, but I'm hoping we can try to please everybody, huh?
And Mr. Chair, to answer your question, the next meeting of the Budget Advisory Committee is Tuesday next week.
Very good. And do you think you'd be able to attend that, Allison? And
What
is it-
time of day?
what time? Yeah.
That is at 3 o'clock, 3 to 4:30. And we could put you at the beginning of the agenda or the end, depending on your other commitments.
I could make that work, Lori. And Grace, it might be nice to have you there as well, as you were more directly involved in the review committee process this year.
Really appreciate your willingness to speak to the concerns of the budget committee. And, I really appreciate the budget committee's work too, because that's a public sounding board to get impact and express concerns. So thank you for bringing those up, Commissioner Hawkins. All that being said, we still have this item for action in front of us. Any further concerns, questions, thoughts about the public health grant recipients? I again just want to express my gratitude for this committee. Very difficult process, and especially when the requests are much greater than what we have budgeted for. Yeah, it's difficult work, and it's important. As you can see, these are all nonprofits, as is necessary for the grant recipient, but the incomes of those nonprofits are very limited. This is one crucial part of their operations. So,
Mr. Chair, I would just also note, maybe I'm stating the obvious here, but this board, the Public Health and Human Services Board, will not meet until a week after the full board, the county board sets the preliminary budget and levy. So,
well, we're just going to have that at 30%, right? That joke is not funny still, huh? I have a twisted sense of humor. That's a really good point, and that was not obvious. Thank you for bringing that up. What that means is that we need a motion today.
Can I-
Please, Rana.
Question, are we just talking about the grants that have been proposed, nothing to do with childcare yet?
Well, I mean, two of the proposed recommended grant recipients do have childcare roles, and so there is that, but we're not yet talking about that potential $360,000. Does that answer your question?
Yeah,
Okay.
and also we talked about maybe that we wouldn't need that much, or we wouldn't need, because some of that new money would be factored in there too.
Yep, and that makes it, again, difficult to navigate and to see what we want to do. For example, I would be comfortable removing those two recommendations if we also approve the $360,000, but I am not comfortable removing those recommendations if we do not. So, got a little chicken egg going on, but how does the rest of the board feel?
Do you want to table this one and have the follow-on discussion before you make a decision? We will still vote on it today, but we can have the follow-on discussion first, if that,
Is that a motion?
I can make it a motion. I was asking it as a question, but I didn't know if that was something that the group would
Yeah.
prefer to consider.
Yeah,
Then I'll make a motion to table this issue until we have resolved the next item B below, which is affecting the approval of use of up to $360,000 of Public Health and Human Services fund balance for 2023.
we have a motion. Thank you. Is there support?
Support.
Commissioner Strelly supports. Thank you. Further discussion there? Just moving it down?
Just swap.
Just flopping there. Call the vote. All in favor to table till after our item B?
Aye?
Aye.
Aye. Opposed?
I'm abstaining.
I'm sorry,
Oh.
yes,
I'm abstaining from the vote.
can you, speak to why?
Well, it seems like, I don't know, it's county money either way, if we spend it in the grants for childcare, or if we don't need to spend as much of the supplement, the balance of the budget, and save that for something else later because they already have the money from the grants. To me, it's kind of a toss-up. It's not like, it seems to me it's more confusing to vote now on this.
And that's why we're putting it second.
Yeah. The reason I was asking for clarification on your abstaining is just that my understanding is in order to abstain, there needs to be like a legal reason why you can't vote if it's a conflict of interest or anything such as that. But otherwise, I think we all need to vote.
Okay, I'll vote no.
Okay, thank you. Motion passes here 4-1. The motion is, the item is tabled beyond item B, and then we can dive into that if we may.
All right. Thank you, Commissioner Mills. I'll start with a little context setting, just to reground ourselves in this discussion, and for those who are tuning in who weren't connected to the special board meeting last week. So we had a special Public Health and Human Services Board meeting last Wednesday, August 10th, to discuss the county's role in supporting child care needs. This was at the direction of this board in July. The meeting was not live streamed due to the internet outage in county facilities that date, and it was not recorded due to human error on my part in not hitting the record button, unfortunately. However, we did get meeting notes, and the presentation materials are published now on the county meeting portal and are linked in the board packet today. The proposal at this meeting and before you under items for board action is to approve up to $360,000 of public health and human services fund balance in budget year 2023 to support the SMART goals as developed by the Rural Child Care Innovation Program Group, the RCIP team. Those goals include provider subsidies and the creation of a child care coordinator position. As discussed at last week's meeting, we are, at the direction of the PHHS board, focusing our efforts on furthering the goals of the RCIP group under financial support to provide stability to our current provider pool, incent prospective providers, all with no levy impact on budget year 2023. That $360,000 maximum use of fund balance would be reduced by any grant opportunities that we receive through deed or other competitive grant processes, or any funding allocated at a state or federal level to support child care provider subsidies. We do have a number of members of the RCIP team here, our CCIP team, that I would invite to share any perspective, or if there are any questions from the board specific to their work on the finance subcommittee or in general throughout that process. I received some questions from Commissioner Akins via email that I'm happy to follow up with the board here today, or to summarize via email or record in the meeting minutes. Most of these questions were around our child care assistance program, enrollment locally, which is a subsidy directly to families, subsidy to providers, but it is based on families' income eligibility. And Commissioner Akins had some follow-up questions around licenses, as well as the 114 spot deficit that was referenced in the presentation. So I think what I'll do is just ask if you'd like me to review those now, or if you have any other specific questions for me or members of the core team who are here today around our proposed use of fund balance to provide provider subsidies and develop a child care coordinator position.
Thank you, Allison. One concern that caught my ear at our special meeting was brought up by Commissioner Akins, and it was about our fiscal policy, and that's certainly something I do not want to be in conflict with. And so I just looked that up, and indeed, reading the first part, I was like, oh boy, this is contrary to the policy. But then reading on, it looked like this could be appropriate here, and it's under item F of our Cook County fiscal policy that we approved in 2020. I'll just read that for everyone's benefit here. Whenever possible, the Cook County Board will ensure in its budget preparations that anticipated expenses are paid with anticipated revenues raised during the same fiscal year. The Board will eschew deficit spending that relies on use of fund balances. Only in an emergency or when fund balances exceed previously set levels should fund balances be used to fund current expenses during budget preparation, and then only for one-time expenses and with explicit public acknowledgement and a plan for restoration of the fund. And so the part that caught my ear that could justify this is, or when fund balances exceed previously set levels. And in item G, it defines what those levels are. And for the PHHS fund balance, it's 40%, and we're well above that. So this is a time where it could be appropriate to use fund balance without going against our fiscal policy. At least that's my interpretation. If others see it differently, I think it's certainly something we should discuss. The catch there is the one-time expenses. That's something that we don't yet have a plan for ongoing. So right now, this is a one-time expense, but my hope is that we can develop something more ongoing. But then the thought is it wouldn't be good to use fund balance for that ongoing operation. So that's again my interpretation.
And if I may, Commissioner Mills, wanted to share a recommendation from Pant Campanero, who is a member of our advisory council and has served throughout the process on the RCIP team, that one of her suggestions following last week's meeting, just in response to the concern about this being a one-time solution, that's not a long-term sustainable way to support providers and address the acute child care needs in our community, was that her suggestion was to form a subcommittee with commissioner representation, just to have more involvement and process and structure around long-term funding solutions for child care, that we could structure that after similar work groups within county government, that this could happen within the Public Health and Human Services Advisory Council as a subcommittee.
Okay.
And certainly that if the board chooses to take action today and grant approval to use up to this amount, that we will continue to keep this board up to date on development of the program, pursuit of additional funding opportunities.
Yeah, I appreciate that. I think that's a good recommendation to try to figure this out better. Commissioner Svalson, you had a comment or question?
I just wanted to point out the one area that you hadn't talked about. You stated it, but then we didn't follow, was that it also included the one-time use if you're greater than 40%, does give you a window, but incumbent upon that use, it said a plan to restore.
Yeah.
So you got to reiterate that it's a one-time use. I think that's a great thought process, because that was where my mind was going, was who is taking on the charge of finding that other way, right? If we say this is a one-time, then we've got to put together a team that's going to go after this to find that other mechanism to fund going forward, so we don't come back here. Then we would clearly be in violation of what we set forward as our guidance on, fiscal policy. But it's the restoration piece on the end of it. I think that when that was formed up, that was a good thought. I just thought we should have some discussion.
Yeah, I really appreciate that. That came into my mind as well when I was reading it, and I thought, if we're above our goal, I don't know, and clearly that is what item F is saying, is that we should restore, but if we're above our goal, then we're restoring to above what we're recommending.
I know.
And
That
it's
seems
like,
contradictory.
And I
It
didn't
is,
know
it
if the
is.
intent was, if you were just above, then, and this puts you below
Right,
to
right.
come back. I wasn't involved in that discussion, so I didn't know the intent
Yeah.
of the.
But I mean, what you're describing, I mean, the fund balance would infinitely increase.
Yeah.
Right,
Yeah,
if you.
which isn't,
Right.
that's not
Yeah.
what you're looking to do
No.
either, because then you're collecting more from the taxpayers than you need to be taking.
right. And so, yeah, I appreciate you pointing that out,
Yeah.
because it struck me as well, so. We should clarify that in the policy, absolutely.
Yeah.
That's contradictory.
Yeah, if you have a very healthy fund balance, as we currently do, to take some, and what's important on this discussion, Allison, I believe you stated, if we were to use that total amount, it would leave us at what level in Public Health Human Services fund balance?
69%.
69%? Yeah, so
Yes.
it's, what we're left with is still above the 40% minimum. So I don't know that the restorative piece is a requirement for today, or that's my interpretation of what we're hearing. Doesn't mean it's right, but it's,
That's also how I interpret it, but it's
Yeah.
very easily interpreted differently. So
Correct.
that's
yeah,
what
so
I
I think a
appreciate.
clarification on that, moving downstream it's important. Yeah.
I presume that's noted. Our policy, our general government policy work.
Yes.
Thank you. Further thoughts? Questions, concerns? Do we want to, we have a good group of people here. Do we want to hear more from thought processes, or do you have questions for the group?
I wanted to ask Commissioner Hawkins if you felt your questions had been addressed, and if you thought those needed to be read into the record.
No, they were for me.
Okay, and I just
Yeah.
wanted to make sure. Yeah.
Okay, Commissioner Storley?
Yes, and I agree with our statement there needs to be revised a little bit so
Okay.
that people understand that we're not asking for more money than what we actually need to use.
Do you think it was the intent of that when it was put in place that that using the one time, if you still retained above
Right.
when you were completed with it, that you weren't required to have the restoration piece?
Right.
Okay.
Yeah.
Okay.
And that was the Budget Advisory Committee that developed that policy, correct?
Yep, and then the board approved that in 2020.
Okay, thank you.
And I will just say, I did bring that up at one of our Budget Advisory Committee meetings, and there was no consensus to change that yet,
Okay,
Yeah.
okay.
but it has been discussed.
It's for discussion, I bet.
I mean, to the extent that there's confusion at the board level about how to apply that, I think we do need to make an effort to clarify it.
Very good. Yes, Commissioner
I'll
Storley?
say, just another thought about something else. So, I appreciate Pat's comment about having a committee. If you don't know what else to do, just get a committee going. However, I think that if we go ahead with the idea of a coordinator, then a coordinator would be able to coordinate and, get maybe one of us, if that would be necessary, or form a group through a coordinator rather than another subcommittee from us. That's just my thought.
Thank you. Commissioner Swalson?
I understand your position on that. I think it's a big ask of a new employee coming in to take on this role and then also be required to try to come up with a funding stream. I just think it's a better idea to put together a team of people that would be more inclined to have the right thought process and connections to really ferret out, because you might end up with a variety of things that, yeah, anyway, if I was new coming into the position, I think I would find the task very daunting to try to take on.
It's part of the job description.
There you go.
Yeah, you might not get too many applicants. though.
Well, yeah, I would think that, I'm assuming if we approve the coordinator spot, that they would be involved in that
Right.
process one way or
Oh,
another.
sure,
Yeah,
oh,
big
sure, sure,
time,
but just
Right.
if you had to
Yeah.
be the ones that were trying to pull together the group and everything else,
Yeah.
that might be a big ask.
Yeah, I
Which is-
think,
That's my thoughts is all.
yeah, yes, yeah, I think teamwork, yeah, many hands make light work.
Right.
Very, very good points.
And I think it's important to mention as well that we do have a team of folks that are already deeply engaged in this
Exactly,
work
yeah.
that we can continue to support.
Absolutely.
That may or may not be in this room right now.
Yes, exactly.
Very good. Well, any other questions or thoughts? Does anyone from the RCCIP team want to speak at all to what we've been discussing or what we've been proposing? Please come up to the microphone and chat a little. Name please, and
Sorry. My name is Bill Hansen, and I think I know everybody in this room, but, and I've been involved in the Early Childhood Coalition for years now, 5 or 6 years, just because I think it's one of the most acute and problematic issues facing the county and the country, as far as that goes, and on a number of levels. And I could go on for hours here, but I won't. I think you're well aware of the issue. I just want to say I'm strongly in support of the proposal as it's before you. I think it's a wonderful first step, but I would urge you as a board to consider it as a first step in a comprehensive system, ongoing system of child care subsidy for Cook County. There's no other solution than, and that's been proven in virtually every developed country in the world that has subsidized child care. There's very little downside and huge upside in releasing people into the workforce, providing early intervention for children with special needs. It actually would be a big step in solving our housing problem, because young families who are trying to encourage to move here or live here or develop here are being turned away now because the combination of child care costs and high housing costs makes it impossible for them to get a foothold in the community. So by removing one of those expenses for those families, we would enable more families to afford housing. And I think I would, in my study of the issue, I would recommend moving toward a system where, like the federal system that was proposed earlier this year, where the means testing is that people pay 7% of their total household income toward child care as a maximum, and then anything above that in the cost is subsidized, and subsidized at a level where child care workers, child care actual providers would be paid on a par with public school teachers, and paraprofessionals in child care would be paid on the same level as paraprofessionals in the public school system as a goal, because that makes it a living wage for the people that work in the system, which it is not right now. The average, northeastern Minnesota, the average wage for everyone involved in child care is just north of $12 an hour, and we all know that's insane. So, and I would also encourage you to think about a source of revenue that you might not have considered. And in talking to Brady Powers, he told me that the 1% tax that was passed by referendum in 2009 to support the building of the Y and the library and the tennis courts, and I remember there was like 6 items on that list to pay back bonds for that, which is ongoing, passed. That legislation, when I actually read the statute, well, Brady says ironically, because of the pandemic, that those bonds will be paid off earlier than expected, probably in the next 2 years. And the statute, when you read through it, In the termination of the tax, it says tax imposed under subdivision 1 expires at the later of 1, 20 years, or 2, when the county board determines the amount of revenues received is sufficient to pay for the principal and interest on any bonds or obligation issued to finance the projects in subdivision 2 of the projects that I just summarized. Any funds remaining after completion of the projects and retirement or redemption of the bonds may be placed in the general fund for the county. So in other words, the legislation sunsets that tax at the later of when the bonds are paid off, or after 20 years, which would be, I believe it was implemented in 2010, so 2030 roughly. And it's over $1 million a year that could potentially go into county coffers and could be used to establish the subsidy system. It would only get us to 2030, at which point we would hope that the state and federal government come to their senses and implement either a statewide or a national child care subsidy system. But if not, we could at that time consider going back to the legislature and the voters to renew that tax for that purpose, and perhaps others, perhaps housing. So it's an opportunity, I think, that we should keep in mind going forward. It's a tax that's already in place. It's actually, probably the majority of it is paid by people that don't live here, but cause us to have these problems with their presence. So I think it's really an appropriate way to fund this. Yeah, that's about all I have to say. But in the short term, I'd say thank you for your work, and thank you for taking a step in this direction. This also would be, I would note that this, by using the 7% limit for means testing, when people are able to afford childcare and people put their children in childcare, then they're able to go to work, and then their income goes up, so their 7% contribution goes up. So it would be somewhat self-healing in that respect if you think about it, and would be a big step towards solving our shortage of workers, and a huge statement of support for young working families in Cook County. Also, Cook County is probably the only place in the state that could do this because we're geographically isolated. If you did this in Richfield and you offered subsidies for anybody coming for childcare, you'd be swamped immediately with people coming in to take advantage of it. But here, because of our distances, other than people in Silver Bay that work in Cook County and Finland a little bit, we're isolated enough that we can actually implement our own system and not be overwhelmed. So the cost would be relatively low. My back of the envelope is about in line with this year's request, about $300,000 to $350,000 a year, including full subsidies for every child that needs it, full salaries, as I mentioned before, and coordinator position to do the means testing in the administration. So I think it's a golden opportunity, and I urge you to think big in this case. This is something that could really, really, really help young working families in Cook County, and then eventually mesh seamlessly into a national program when that happens. So thank you for your work, and thank you for your time. Any questions?
Thank you, Bill. No questions. Thank you for your work on the early ECFE or the Early Childhood Coalition, rather.
It's been an honor, and it's a great group that's done a lot of deep thinking on this subject. So I urge you to keep going forward on this issue. It's a really, really important issue, and it's just I think it's the main thing we can do right now to improve quality of life in Cook County. So thanks.
Thank you. Does anyone else want to speak at all on the issue? Well, please, Nancy.
Good morning, everyone. I'm Nancy Deming, and I'm actually the head of the core team for the RSIP group here in Cook County. And you've all seen the numbers. We've talked about the numbers. That's just something we have to talk about, right, to be able to fix this. So I want to just very briefly tell you a story that's on my heart. I worked for a couple of years as a toddler teacher and a preschool teacher, and a good friend of mine's childcare and preschool down in Two Harbors. And as the toddler teacher, there was a little boy who came into my care. At 15 months, he spent about a month in the infant room and caused chaos over there, this little man. He came into my room, and I could see right away that he was very bright. He had wonderful communication skills. He had a lot of social emotional skills that even for a toddler, we needed to give him a lot of support on. And I'm going to give you a tiny bit of background on this little boy. He was reported to Child Protection Services when he was about 11 months old. He lived at the time with his mother and his half-sister, who was 4. So Child Protective Services got involved. They ended up taking him away from his mother's care and putting him in foster care with a friend of the family. When he came to me, he was in foster care with a friend of the family, okay, who brought both he and his half-sister to our program. He was probably with that family maybe for about 2 months as the court system kept working. Eventually, in this course of a year, he went from foster care with some family friends. The mother came to see him one time with her social worker, have a visitation out of probably 10 opportunities that we were told she was going to come. She came once. So obviously the mother needed a lot of support on her own. The process went through, and eventually he was taken from the family foster care, given to foster care for the grandmother of his half-sister. Then he was given into foster care of the grandmother of his grandmother on his dad's side, because the dad didn't have a name on the birth certificate, all while the dad's fighting for court to be able to have custody. Here's our little man, right? And he just has chaos in his life. So we have no surprise that when he comes to preschool, to childcare, he sometimes acts out, he has big emotions, right? What could we expect? He has no stability in his life. But one day, when I was getting ready for work and thinking about how to help him, being a child care provider, I am experienced in trauma-based care and presenting a healing environment and training my whole staff on how to do the same with little people, to recognize the things that they need for their own mental health and development. You've already seen all the stats about how much early care makes such a difference for these little ones who are before they even turn 5 and get to kindergarten. So as I was getting ready one day and thinking about this little man, I realized that I, as his child care provider, was the most stable person he had had in his life for the first 2 years of his life. That was quite a sobering but wonderful honor for me to realize that through myself and my staff that were in our room, we were the ones that are sure that he felt safe where he was, that this was a stable place for him. There are many times that when I sat and talked to him to let him know nothing that he could do was going to make me leave him, that I accepted him just as he is. All his big emotions are not going to cause me to leave you. Sometimes as childcare providers or preschool teachers, we have to remind ourselves, or it might just be me, I'm the adult, this one is 2. I'm the adult, this one is 2. Like, I should be able to last longer than the 2-year-old, right? But I really wanted to share that story about our little man who now is going into kindergarten. And he's such a joy. I'll never be forgotten in my life. That you are looking at being able to help similar professionals who are required to be trained to be able to take care of some of our most vulnerable people in this county. They love what they do overall. I love what I did. It was wonderful. I looked forward to going to work every day, and I slept real hard when I got home at night, right? But they don't receive that recognition for what we do. And I know that the work that many dedicated childcare providers have done have helped keep children from visiting Grace Bouchard's department in the end, or helped families feel supported enough that they're able to cycle out of those sort of interventions. So although you have all the numbers before you, and I absolutely respect the decisions that you make for Cook County, I just would ask you to really think about some of the families that we're supporting, but in my heart, the kids that we're supporting, and the foundation that we're giving them for the future as residents here in your county. Thanks for letting me share.
Thank you. Is there anyone else who would like to speak on the topic, if you're part of the team or otherwise? Looks like not so much. then we will, I would entertain a motion here if we want to proceed, or if we have some other ideas or thoughts or concerns. Commissioner Storley?
Last meeting that we had last week on childcare, other than the prospect that we could hire a coordinator, I was depressed. I went home and I thought, what are we going to do? I mean, this is such a big topic, and where are we going to go with this? Until I read the shopper on Friday. Much needed new daycare center opening in Grand Marais. I thought, yay, finally. And I did call this gal, and we had a really good talk about some of the process things that she went through in order to have this in her home, and how much support she would look forward to having someone who would visit with her and help her through paperwork and help her through all the things that you really want to do. She has already a full house, and she has a waiting list. So we're on the way. That's great. And with more support, we can even be more on the way.
Thank you, Commissioner Storley. Any other thoughts from the board here? Questions, concerns, suggestions, motions? I'll make a motion to approve the use of up to $360,000 of the PHHS fund balance for 2023 in support of the RCCIP SMART goals, including provider subsidies and the child care coordinator position. Is there support? Rana supports. Thank you. Further discussion?
Would we want to include in the motion the establishment of the committee to look for that to going forward, or just take that up as a matter of course, matter of business?
It's a good question.
I simply asked the question. That's all.
It's a great question.
Because certainly we've talked about it, and it's one that, you know, but I think that would need a separate vote then to approve that if we don't include it.
Mm-hmm. Well, I'm very comfortable amending my motion to include that creation. I don't know that we need to define it at this point, but just that we will do it. Does that make sense to people, or?
I don't want to muddy it, but I just thought it might.
I think it's a critical support piece for the provider.
Since we
and
recognize
the
this is just a one-time funding, and then we have to find that separate funding source.
Yeah, with commissioner representation, right?
Correct.
Yes, yeah.
Correct. If that's your motion.
I would like to amend my motion to that. Do you have support with that amending? Thank you, Rana.
Thank you.
Thank you for that point. Any further discussion? Commissioner
I
Hawkins?
just want to clarify. So we are recommending use of fund balance to fund a new position for 1 year or forever?
My motion was to approve the use of up to $360,000 for 2023. And that's for addressing the SMART goals as well as that position. So that's the extent of my motion. So that's just 1 year. We'll see if we can
If the funding
sustain
sources
that.
come, if the funding sources come through to continue.
Please, Rana.
Does that mean that we'd have to wait until January to hire somebody or to really get started on the program if it's 2023? That seems like a long time from now.
It's a very good point. When I blink, I think it will be 2023. But
I think it will.
the need is now, but there is still a lot of process that needs to happen, I think, before we can responsibly enact it. I think it will take until January of this year. I'm certain the work will continue as it has been, but there's a lot of development that needs to happen before we can just implement those funds. Am I understanding that correctly?
Yeah, if I may, just to clarify that the provider subsidy program would begin in January of 2023. We will work to perhaps incorporate the child care coordinator position within our department under licensing, or explore other options with the involvement of the core team as to how best to staff that child care coordinator position. If it's a county position, if it's a contracted position, I don't know that we can define that at this point. It's still in development, but the proposal before you is to use fund balance to offset the cost of that position in 2023, as well as the provider subsidy program.
So potentially, a part of that position is already in our budget with the family licensing, or the family childcare licensing position, and we'll just see how that can mesh or change, or as
And
need
so
be.
just to clarify, so this wouldn't be the addition of a full 1.0 FTE, it would be, I'm not entirely clear how Heidi's position relates to this position. Are they two separate positions then, or?
At present, yes. So Heidi is currently our licensor. Her role previously was as the primary intake social worker for the department. Those responsibilities were reallocated across all human services staff earlier this spring. So the vision for her position was to grow more in that area of outreach and support for childcare, as well as preventative family services. So that was very much in process at the time that she resigned her position. The budget, that $360,000 includes assumption of a full-time position with benefits. So it is possible that the expense would be reduced if we were to incorporate these duties within PHHS and that licensing position. That would also change how that substitute pool program is structured, as it could be a conflict of interest for a person to be acting both as the county licensor and as a child care provider.
Mm-hmm.
So if that is the path forward, we would likely reconfigure that and having this individual coordinate a pool of substitute providers, similar to the in-home support program that you heard about earlier this morning. Otherwise, we would explore the full-time position where a person is both providing that administrative support and acting as a substitute provider. So there are a few different ways to achieve that. Again, all contingent on the proposal before you today and our ability to seek out additional funds, which is another key factor.
Yeah, so there is the potential for a 1 FTE with benefits there, but I think it's all of our intentions to support our community as best we can, and also responsibly use taxpayer dollars. We don't need to just hire someone full-time if we can incorporate that and be more wise with dollars spent. And I really appreciate Allison's brainstorming with that, and how the department can change and adapt to the needs of our community, and again, just with the resources that this board provides.
And I appreciate the elaboration. Thank you.
Thank you for your questions.
Further discussion? Hearing or seeing none, all in favor?
Aye.
Aye. Opposed?
Me.
Motion passes 4-1. Thank you very much. Now we're back to item A, the recommendations for the public health grant funding for 2023. So, we've now passed the potential use of up to $360,000 for supporting the child care opportunities. And in my mind, I am now more comfortable withdrawing the recommendations of the child care providers as grant recipients. Allison, can you, and Grace isn't here, unfortunately, but can you shed any light on how that may or may not work logistically, as far as, organizations' ability to plan for funding or not funding?
Yeah, talk about a chicken and the egg.
Right. Right.
No, this is certainly a complex and nuanced problem, but I think a good problem for providers to know that we're willing to support them in a variety of ways. So in terms of logistics, what I think that could look like is just having a conversation with the applicants, bringing the review subcommittee back together, looking in detail at the proposal, how much of this grant request and the recommendation before you today is intended as a direct provider subsidy, and do we want to either reduce the grant by that amount? Do we have enough information to make that determination? Do we need to have a conversation with the applicant agency and provider to learn more? So I think what you could do today is approve the recommendations contingent on further discussion about the direct provider subsidy amount included in the grants, and that will come before you again next month or the month following with an updated recommendation. I think regardless, we're ahead of our timeline, right? Typically, we're including the recommendations, or we're coming forward with the recommendations later on in the year prior to PHHS having a role in administering these grants. It was in December when the final levy was set that these entities were being informed of their funding for the next calendar year. So I think we're still in a better place in terms of the timeline for providers, but want to ensure that we're having an informed discussion about the impact of the new provider subsidy program, what that will look like. We still have quite a bit of work to do to develop that program. As you heard from us last week, it'll be modeled after the DHS provider subsidies with an additional amount to bring those subsidy amounts up to the recommended wages in the DEED study, but in terms of how that's operationalized, there's a lot to be determined. Did that answer your question?
Oh, as best it can, I think.
Yeah.
Thank you. Yes, it did.
Yeah.
I'm sorry, Rana?
Well, I don't know who was on the committee that decided these grants, but I'm sure they spent a lot of time and
Yeah.
effort apportioning money, and it would affect the other organizations that were in that group too. And I just feel like we might be cutting them off to something and disrespecting the work that was done. And if we could just maybe go with that for now, and then for next year, we would know it would be quite different. That's just my thought. I just hate to see,
Yeah.
it seems kind of unfair to ask a group to make a big decision like this and then to say, oops, no, we don't want that.
Yeah. And that's a very good point. Commissioner Saulson.
I don't know, I was going to state, I don't know that there's an answer that you can give today on, because we don't know, it wasn't parsed out in this much is going to this much is going to this. I think the thought process was there and ideas, but I don't think we have the specificity here before us to be able to say, my recommendation, I think, is to, it's needing to go back, as Allison says, and let them do the review, and the pieces that would now be funded by what we've just approved could then be either reallocated or taken out.
Mm-hmm.
The thought process I had initially was that those would then be taken out, and this would
Mhm.
reduce that, from that large jump that we saw
Mhm.
year over year. That was where I was headed with it initially, anyway.
Yeah, and I saw an advantage there. I also respect Rana's point about kind of undercutting the process, but the situation has changed.
It has.
I'd say significantly.
Yeah, it has, and to not undercut the process, that's why you send it back to the group to have that continued review, to come back to us with what that final number would be, if that's amenable.
Does that?
Wouldn't you achieve the same thing by saying, just say whatever amount they're getting, we will not use up to $360,000, we will use that much less because we already have that allocated for that childcare situation, and that way people can go ahead and get their budgets done and be confident of what they have to work with for,
I-
at this time.
I thank you. I see your point now. I didn't before, but to your point that we approved up to this amount, if we've already funded some with the grant that we're using here, then that could be pulled back on the 360,000.
Mhm.
Okay, so I guess it's either
Horse
way.
apiece.
It's an
Either way.
option, you know.
Yeah, I just wasn't looking at it that way.
But because the next meeting of this body is not until after the preliminary budget and levy have to be approved, we're going to have to set that preliminary budget based on the 191.
Yeah.
With the caveat that it could go down.
Well, but as Raina's saying, it doesn't have to be the 191. It could come from the 360 as well.
Right.
You move forward
that's-
with the 191.
I think we're saying the same thing.
So I understand now, thank you.
Well, okay, yeah, and it's hard to say what would be better for, for our community, which,
And the grant is for this, the thing that we're proposing to change is more than just childcare. So if we change it, those other things are going to be affected. Well, maybe if we don't need it for childcare, maybe they'd like to give some of that to the other programs, or maybe there were other programs that they didn't consider. I mean, it's more complicated than
yeah,
just one-to-one
Yep.
at this point.
yep. I hear you, and I think I'm on the same page. Yeah.
Mr. Chair, I'd just like to note, our committee of the whole meeting is scheduled to start in 10 minutes.
Well, we still have 10 minutes.
That we do.
Thank you for that time check. Well, I'm entertaining a motion right about now, and we have 10 minutes to entertain it. Which direction would the board like to go?
I will make the motion to approve the $191,000 for the grants as called out by the committee that established it for Public Health and Human Services grant funding for 2023.
Thank you. Is there support? Rana supports. Thank you. Further discussion? Do we want to include anything in there that things may change with this 360, or we're just going to roll with this year and then? Okay. Yeah. Thank you. I got.
It's all on the record.
Yeah.
That's my view.
Got nods and.
The intent is clear.
Any further discussion? Hearing or seeing none, all in favor? Aye. Opposed?
Nay.
Motion passes 4-1. Thank you. That moves us down to item C, that is the job description for the behavioral health supervisor.
I'm wondering if we shouldn't just wait until next month to have this discussion to ensure we have enough time to address questions from the board, present information. In interest of time, I'm happy to defer that another month.
Yes, thank you. How does that affect the structure of the organization and planning and whatnot? Are there immediate questions that the board has that we can throw at Allison to try to address it at the future meeting? Immediate concerns? Then I'd entertain a motion to table this item until next meeting.
Make that motion.
Thank you, Commissioner Swalson. Is there support?
Support.
Thank you, Commissioner Starley. Motion and support. Any further discussion? Hearing or seeing none, all in favor? Aye. Opposed? Motion passes 5-0. Item is tabled till next meeting. Moves us on to committee reports. I'd also entertain a motion to table these reports until next meeting due to time constraints.
So moved.
Thank you, Commissioner Swalson. Is there support? Thank you, Commissioner Starley. Further discussion? All in favor?
Aye.
Aye. Opposed? Motion passes 5-0. Entertaining a motion to adjourn.
Support.
We'll call it adjourned. Thank you, everybody.